In today's video, we'll go over how to write a physical therapy evaluation. I'll break down the key components of a PT evaluation and share some tips on how you can become more efficient with your evals. And be sure to stick around to the end because I'll share an example of a full evaluation template which you can find in the description or by visiting PTProgress.com/templates to help you save more time and to write better notes in the clinic. And if we haven't met before, I'm Tim Fraticelli and I'm a physical therapist and founder of PTProgress.com. And on this YouTube channel, I share videos about career, treatment, and technology, so be sure to subscribe to the channel for helpful videos each week. And a big thank you to MedBridge for sponsoring a portion of this video and for giving you $175 off of MedBridge when you use the promo code PTProgress. We'll talk a little bit about that later, but first, whether you're a student or a current physical therapist, I think you're going to find this helpful as we break down the basics of an evaluation and also cover the basic structure of an outpatient physical therapy examination, or the time that you actually spend with the patient. You see, a written physical therapy evaluation synthesizes all of the information that you gather during a physical examination. Oftentimes, the term physical therapy evaluation and examination are used interchangeably when referring to the patient's first encounter with the physical therapist. You might say, today I had 3 evals, or the patient might say, today I went to my first physical therapy examination appointment. It's all referring to that initial visit. And everything that happens during that initial examination goes into our report that we write up called the physical therapy evaluation. But before diving into the how behind writing a good evaluation, let's review the why and the what. Now, in terms of the why, it's your first encounter with the patient. The physical therapy evaluation will set the expectations for the rest of the plan of care, or that time that you anticipate seeing the patient. You see, your evaluation documentation will become a part of that patient's medical records, along with the notes from every subsequent visit that you have. Now, these records are important because other therapists, physicians, and even the patient's health insurance company may reference your notes in the future. The patient may also request their therapy notes, so it's important to write accurately and thoroughly. In terms of the what for an evaluation, let's talk about that. Those components of the evaluation make up the what behind an evaluation. That initial patient evaluation occurs in 2 parts, the clinical examination and the written therapy evaluation. In terms of the clinical examinations, most clinics set aside 45 to 60 minutes for the initial exam, during which you may cover the following information: the patient's medical history, a systems review, tests and measures, posture and gait analysis, range of motion and muscle strength testing, special tests, home exercise prescription, goal setting, and treatment recommendations. It can be a tough thing to remember all of these items during your exam, so it's good to have kind of a checklist or a template to follow during your examination. Now, as for your written evaluation, this is a report of all of your findings as a professional assessment of the patient's needs for therapy. That written evaluation may take anywhere from 15 to 45 minutes to complete after you're done with the visit, depending on the amount of information that you've got to report or the efficiency that you have with your documentation system. The more evaluations that you do, the better you will become at writing them, but it's always helpful to see written examples, so I'll share some sample components of an evaluation later in this video. Okay, let's talk about the actual examination, because the components of a thorough therapy evaluation starts with the initial exam. Each of the aspects we cover next will strengthen that written evaluation that you'll produce afterwards. Now, before the exam even starts, you're going to look at that patient intake form. A good patient intake form is like a roadmap. It's a concise roadmap that will help you to identify some of the major issues and even prompt questions to ask during that examination. I know it seems simple, but be sure to read through this intake form. Your patient spent the time to fill it out, so take a minute to read through the form before you start. Okay, now you're ready to take the patient back for the examination. Your first impressions with that patient can really impact the rest of the evaluation and treatment session, so it's very important to put the patient at ease with careful wording with your introduction. I typically welcome the patient back and say something like this as I'm walking the patient to the room. Hi, I'm Tim. I'm one of the physical therapists, and I'll be working with you today. Have you ever been to this clinic before? Well, welcome. It's good to have you, and we're going to be in this evaluation room right here. I start the eval like this because I try to avoid saying something general like, how are you today? Because there's a good chance that they're not feeling that well. And if they say, I'm feeling miserable, well, we've already started the evaluation or the examination on a negative note. And if they were feeling good, there's a good chance that they might not be there today. So I've just found that it's helpful to, or easier even, to navigate that initial introduction when I keep the first few comments more on the neutral side and the positive side of things. So it allows me a little bit of time to get back to that evaluation room and it gives me the opportunity to set up that expectation for the visit and then to direct the flow of questions with my patient interview questions. I share a list of 10 questions that I use to guide my subjective interview, which you can see in a different video that I'll link to as well. And while you shouldn't necessarily write out every single question you plan to ask the patient, you should be able to talk conversationally and lead that examination smoothly as you discern the most appropriate tests and questions and treatments to provide to that patient that day. Okay, on to the patient's history. One of the first elements covered in a physical therapy evaluation is the patient's medical history. As a physical therapist, you should inquire about that patient's medical history carefully and intentionally, because without specific questions from you, the conversation could spiral down a path of irrelevant information for the day. The patient can go on and on about things that really aren't relevant to their main complaint, which can really shorten their evaluation. So it's your job to be direct and ask the patient about pertinent medical history and the events that led them to seek physical therapy for the issue at hand. As you start gathering information from the patient during your exam, you'll hone in on the specific questions to identify how various body systems are involved. You're going to rely on that critical thinking to sift through some of the various information and systems from neuromuscular to cardiovascular and integumentary. Your understanding of how these body systems respond and work together based on the patient's symptoms and presentations, that will inform your diagnosis and your treatment plan. So a thorough examination of the systems is a key component to your physical therapy evaluation. During the examination, you'll use a variety of special tests and measurement tools to gather relevant information about the patient, from range of motion to manual muscle testing and neuroscreen tests. Your exam is going to be tailored to that individual patient. Now, that being said, you don't need to perform every single special test available to conduct a thorough exam. As you grow in your PT career, you'll gain experience and become more efficient in assessing each patient. Of course, if you want a refresher, most of those common special tests are found on this channel here. You could just look in the special test playlist on the PTProgress YouTube channel. After gathering and analyzing all of this information, by the end of the exam, you should be able to understand the key factors that are contributing to the patient's pain, discomfort, or overall functional limitations. Try to briefly summarize to the patient your initial prognosis and the plan for their care. As you present your findings, be aware that people respond differently to this type of news, whether they have a minor injury like an ankle sprain or they're recovering from a major surgery like a total joint replacement. Make sure that you communicate clearly and have empathy as you help them understand how physical therapy can help them achieve their goals. Part of the initial physical therapy examination visit may include some treatment intervention. Sometimes a good way to wrap up an examination is by identifying specific movements and helpful exercises based on your findings. So by the end of the session, you'll be able to provide a list of home exercises the patient can do before they see you again. This is also a good time to set an expectation of visit frequency and other treatment recommendations, because what you prescribe or recommend may or may not correspond exactly with the general recommendations provided by the physician's script for physical therapy. So explain your reasoning and answer any relevant questions that they have and give them instructions on what they should do next. If we've finished everything that we need to know for the visit, I'll walk them back towards the front and then have them schedule with the front desk. All right, now that you're done with the examination, realize this is just half of it, and it may have taken you a full hour to perform that examination. Now it's time to actually write the physical therapy evaluation note. Having a framework for your exam will definitely help you to become more efficient in your documenting, and your findings will be more clear when you have this type of structure. And while it definitely is helpful to document as you go, you cannot always expect to finish the entire written evaluation within the examination time. You'll likely spend another 15 to 45 minutes typing that evaluation after the visit is over. So let's take a look at the components of a written physical therapy evaluation. But before we do that, a quick word about this video's sponsor today, MedBridge Education. I've personally been using MedBridge for over 3 years to complete my continuing education requirements online, and I just renewed it using the PTProgress discount code, which saves you $175, and it allows you to renew each year at that discounted rate. They're constantly coming up with new courses, and it's really easy to get live CEUs through their online webinars, which can count towards in-person CEUs that I need for my state. I use MedBridge every day in the clinic to create home exercise programs for my patients because it's one of the most comprehensive libraries of treatments, and the MedBridge Go app is really simple for patients to use as well. It's just one of the resources that I use to be more efficient in the clinic, and if you're interested in MedBridge, you can use the promo code PTProgress to save $175 on MedBridge this year. Alright, the overall structure for a written physical therapy evaluation follows the broad form of a SOAP note: subjective, objective, assessment, and plan. And while the documentation from an initial evaluation tends to be more detailed than typical follow-up notes or daily notes, it still follows the same basic format. The first section of a written evaluation usually has an open text area to write out the subjective, chief complaint, or the past medical history. This area is used to document relevant information about the patient and why they came to therapy in the first place. Some EMRs, like the one that I use in the clinic, rely heavily on checkboxes and drop-down options, but most of them have a free text section to write out a patient's subjective and past medical history. Here's an example of one free-form subjective input. The patient is a 62-year-old female who presents with complaints of right knee pain, status post, total knee arthroplasty, performed on 11/29/20. The patient reports having knee pain for years before she consulted with an orthosurgeon in August of 2020. An x-ray revealed severe arthritis, and the patient elected to undergo total knee replacement in November of 2020. The patient reports the surgery was performed with no issues. She was released home after one night stay at the hospital. The patient lives with family who are able to assist with driving her to appointments until cleared by the physician to drive. The patient's goals are to return to working as a college administrator this spring and to walk without a walker or cane as soon as possible. This is where you detail the patient's story, what brought them into PT in the first place, and a big picture summary that can clearly and quickly explain into the details to anyone who needs to read the evaluation. It doesn't need to be a book, but it should be thorough and summarize why this person is even coming to physical therapy in the first place. The next section of the written evaluation is the objective area, which will reflect the information you gathered in your systems review and any other testing that you were able to conduct during the initial evaluation and treatment. Make sure that you write down all your findings because as the patient progresses and works towards their goals, you can use this objective information as a baseline to show how the patient is progressing with physical therapy. And even if you were unable to complete every necessary test during your initial evaluation, you can still document other key findings here like range of motion, strength, vital signs, neuroscreens, general observations, and other measurements that you performed during the examination. Be sure to also include any relevant data from outcome measures or forms that the patient completes in their initial paperwork, along with any of the other treatments that you provided during the visit. Alright, the third section of the written evaluation specifically answers the question, why does this person need physical therapy right now? You'll use this section to cover your overall assessment of what the patient needs, your diagnosis of their injury or mobility issue, and your prognosis for their potential improvements. You'll also use this section to outline the goals that you've set with the patient for their treatment. Here's an example of an assessment statement. The patient presents with signs and symptoms consistent with diagnosis of left knee osteoarthritis, status post 1 week postoperative left total knee arthroplasty. Rehab potential is excellent. Key impairments include decreased range of motion and strength of the left lower extremity, poor balance and compensatory gait patterning, increased swelling and pain with functional activities such as squatting, walking, and stairs. Skilled physical therapy is required to address these key impairments and to provide and progress with an appropriate home exercise program. This evaluation is of high complexity due to the changing nature of the patient's presentation as well as the comorbidities and medical factors included within this evaluation. Again, this should not be an extremely long section, but it shouldn't be 2 sentences either. You need to give a quick overview of the patient's current state, their key impairments, and the reason why physical therapy is necessary. The data you collected and documented in your objective section should back up any claims that you make about poor strength, balance, or swelling or other issues and helps to give the full picture of the patient that you're treating. This section of the evaluation will also include a place for short-term and long-term goals. Typically, you want to write at least 3 to 4 short-term and 3 to 4 long-term goals that are focused on helping the patient to achieve functional tasks and to address key impairments that are impacting their ability to participate in activities in their home or the community. We'll cover goal writing in more detail in a follow-up video. Okay, and now for the plan of care. The evaluation will generally finish with a plan of care which outlines the frequency of visits that you recommend as well as the potential treatments you expect to provide while treating the patient in physical therapy. Many states as well as insurance companies will require the physician to sign this section in order to approve the physical therapist's recommended treatment. So what typically happens is that you as the PT will sign the note to complete it and then send it over to the physician electronically or via fax to sign and return. Your office will then keep the signed copy as proof that the physician is on board with your treatment recommendations and plan of care, and then your billing office will submit the claim to the insurance company based on the CPT codes that you've selected for the evaluation. We'll save the CPT codes for another video, so be sure to subscribe to the channel for more helpful videos, including the next video on how to write a daily note as well as how to write a progress note. Here's an example of a full therapy evaluation. They're usually about 3 to 4 pages in length, depending on the EMR that you use and how detailed that you are in your writing. But this is the basic structure of an evaluation, and this is what they look like in general. If you're interested in the full evaluation templates that I use and include 4 sample evaluations, assessment phrases, and gold templates, take a look at the link in the description below, or pull up a new tab and visit PTProgress.com/templates. You can get the link to these in the description below, along with the MedBridge coupon to save $175 on your continuing education this year with the promo code PTProgress. Hey, thanks for watching, and I'll see you in the next video where you'll learn how to write a physical therapy progress note. I'll see you there.